Hi, I'm Dr. Mark Rosenberg, and today we're going to talk about arthritis and salt intake. That's a little definition of what arthritis is. Arthra means joint. Itis means inflammation. That's in Latin. And whatever medical, chiropractic, dental school you go to the first semester, they stick you in with a Latin term. So that's what it means. Arthra, joint, itis, inflammation. So it's a broad spectrum of things that could be called arthritis and often are. There's osteoarthritis, there's rheumatoid arthritis. I'm not going to go into those right now. I'm just going to talk about a general overview of salt intake and how it affects your joints. By the way, rheumatoid arthritis is blood-borne, it's genetic, and in one of the previous Anatomy of Chi videos, I talked about the energy of blood. And what happens is it means it's genetic. You got it from your grandparents or your parents. It's very difficult to deal with and it's more like a management case for rheumatoid arthritis than a complete cure. However, osteoarthritis is the most commonly type of arthritis we have. Every joint in between the bones has a space and it's filled with fluids, synovial fluids, and allows us to move our digits like they're supposed to. And what happens is any type of injury can jam the joint, temporarily cause swelling, and later on, if not immediately later on in life, that joint becomes arthritic. What happens is that it's always swollen and it always hurts and it's always puffy. I remember my mom, she had arthritis in her ring finger. She couldn't get her wedding band off. Okay. So what happens is that the bones will actually change. If that swollen condition of lack of fluid and is not repaired, okay, and we'll talk about that in a second. What will happen is more fluid gets laid down, the body attracts calcium and bone salts and starts laying down little tiny spurs. At that point, you'll actually see bumps. Okay, you'll have different type of things that go on in the hand, changes, so where you can't close them, and those bumps are permanent. You've seen people, usually later, older, their hands are twisted and turned, and they can't move them. There's arthritis in the hands. That at that point, the calcium has dripped over. If you took an X-ray, it looks like candle wax dripping over the joint. Okay, it's very hard to reverse. Now, where does salt come into that? First of all, salt dehydrates. So if you eat a lot of salt, in fact, you could do an experiment. Eat a big bowl of salty popcorn before you go to bed. Don't drink any water. And when you get up in the morning, your hands feel all tight. Okay, and that's the reason. So what happens is the joints are dehydrated from too much salt. Okay, if it's in the area of an injury, it dehydrates it even more. The body over time will lay calcium and bone salts down. The technical term is called the piezoelectric effect. In the area of stress, the body will lay down those calcium and bone salts. And what will happen is over time, it will start to try and fuse it. By the way, it happens in the spine as well and other joints. Anywhere there's a joint where there's a space, arthritis can form. So watch your salt intake. So if you eat out, there's often a tremendous amount of salt, even if it's not sodium chloride, which is NaCl. It could be potassium chloride. It's usually used as a flavor enhancer. If you pick up a can of Campbell's soup, and look at the sodium content, it's off the charts. It's like 800 milligrams of salt per serving, and there are 2 or 3 servings in a can of, let's say, tomato soup. So who eats a third of a can of soup? Nobody. You'll eat the whole can, you'll get a tremendous amount of sodium, and then the other things you eat during the day add to that, and then all of a sudden, things start to happen to your body, and you don't know why your joints ache, and you go from doctor, you even try stretching, and you say, gee, it doesn't work. It's because your intake is dehydrating you. That's causing a huge problem for you. So watch your salt intake, and there's also a misunderstanding. Some people say, oh, Mark, I don't eat salt. I only eat sea salt. Okay, where's all the earth salt come from? The sea. At one point, the whole planet was covered with ocean, and then it dehydrated. So you have mines filled with salt. It's the same. NaCl, which is sodium chloride, is salt, is salt, is salt. Potassium chloride. There's a whole family of salts that you could have, and they all have the same dehydrating effect on your body. So drink more water, which will help cut your salt intake. By the way, if you're having too much salt, you'll notice that your skin and your hair is very dry. Again, your body's getting, your nails are weak and brittle. So your body's going to dehydrate you wherever it can. And when it starts hitting the joints, you start to have problems. One of my earlier videos, if you haven't surfed around, is how to pull on your fingers. And the order from Chinese medicine and martial arts is middle, ring, index, pinky, thumb. You do both sides. If they pop, they pop. If they don't, they don't. But what happens is when you're opening up the joint, you're allowing fluids to go in there. It can help with arthritic conditions. As a chiropractor, I use my hands all day long. If you're on the computer, you use your hands all day long. So I'm always pulling my fingers a couple of times a day. I drink a lot of water, and I watch my salt intake. And as a result, I don't have problems with that. When I do, I'll hear a little, what's called, in fact, read some of the comments. People tell me, Mark, I roll my neck. I hear all this cracking in my joints. It may be tight muscles. It could be salt intake, but you have to experiment for yourself and you have to see how it works. And your body will give you feedback. You usually start, first of all, food will taste bland. I can almost guarantee you once you do that. But after 3 or 4 days, your taste buds get acclimated to not having that much salt. And you start feeling better and better and better. And of course, as medical doctors know for eons, well, not eons, 50 years, that too much salt will harden the arteries. And somebody's had a heart attack, the first thing they put them on is a low sodium diet. So there's a lot of benefits to watching your salt intake. Okay. Oh, by the way, too much salt elevates your blood pressure. I can go on, but I just wanted to talk about arthritis today. So again, arthro means joint, itis means inflammation. You're doing the stretches here. You have a problem that doesn't seem to go away no matter how much you stretch the muscle. Look at the joint that you're stretching and see if the function of the joint is not becoming arthritic. Okay, that's today's video, and thanks for stopping by.